Good afternoon, my name is Gabe Flick. For those of you who don't know me, I will be giving my presentation today via video because I'm at a conference and last week I was sick and did not figure you wanted me in class. So my paper was on Cesarean section, indications, approaches, and considerations. So every year reproductive diseases cost the beef industry about $500 million annually. 37% of that, or $185 million, is related directly to dystocias. 20% of all heifers require assistance, and of all deliveries made, 0.04% of them are made by cesarean section. Knowing when to do a cesarean section is dependent on many factors, and several of those will be picked up by an examination performed by a practitioner. So some maternal indications may be an abnormal pelvic conformation, the fact that you might just have an immature heifer who has a small bone structure, a cervical dilation failure, maternal fetal disproportion, uterine tears or torsion, or a vaginal constriction. Some fetal indicators would be an incorrectable malposition, an absolute oversize, fetal monsters, conjoined twins, or an epistematis, or a dead fetus. Some other indicators may be that you have a high-value calf resulting from an embryo transfer or a clone, or you might be dealing with a breed which displays muscular hypertrophy, such as a Belgian Blue, which just isn't going to fit through the birth canal to begin with. So some considerations when electing CS would be that if a live fetus cannot be delivered after 15 to 20 minutes, and some of the maternal or fetal indications have been revealed by an examination of the practitioner, the next things to consider are, is the dam in the calf a good surgical risk? Is the value of the dam in the calf high enough to cover the cost of the procedure? And what facilities do you have available? And what assistance do you have available as well? So when you're considering the approach, there are 8 basic approaches. There are 3 of them which are standing. That would be the right and left paralumbar and the left oblique ciliotomy, which would be the most popular procedure chosen by most practitioners. And there are 5 recumbent, the right and left paralumbar, ventral midline, ventral paramedian, and the ventrolateral ciliotomy. In those positions, you have to cast the cow, so you generally need assistance, and it also puts the incision closer to the ground, so you want to make sure you're working in a very clean environment. Choosing these approaches can depend on many things. Confidence and experience of the practitioner, number 1. Number 2, the status of the calf. Is it dead or alive? If you're dealing with a dead calf, then you want to be able to exteriorize the uterus as much as possible to prevent any peritoneal contamination. The propensity of the dam to becoming recumbent or lying down during surgery, the vascularity of the dam. This can be very important in dairy breeds or those which have a dairy heritage, because a lot of venation in the ventral area is going to make an incision in that area more complicated. The positioning of the calf, and as we said, the facilities and assistance which are available, and of course, aesthetics. If you have a cow which you plan on showing and you're going to take to Denver, then having a large scar down one side is a consideration. So the success in future productivity, calf survival is often very high, 75 to 95% success. Dam survival is high when the calf is alive. And one study out of the UK revealed that 91% of beef cattle out of the procedures that they had done rebred successfully after surgery. So some factors that can contribute to the success of the operation are the rapid election to operate after the examination has been performed, a short surgery duration, the exteriorization of the uterus to prevent that peritoneal cavity contamination, removal of abdominal blood clots during the operation, and the utilization of a Utrecht suture pattern, which buries the knots and also reduces the amount of suture material which are on the outside of the uterus, and that reduces the amount of attachment points for scar tissue during healing, which can lead to future reproductive complications. Economically, is it worth it? The cost of the procedure is around $500. The value of the calf in 2017 was around $1,000. So if the cow and the calf will survive, then yes, it was successful and it was worth it. Most producers would agree that if you lose either the calf or the cow during the procedure, then it was not of any economic benefit. However, you are still meeting your professional and ethical obligations to the animal welfare by relieving the distress of the animal if the birth is not going to occur naturally. However, most producers will still decide to cull the animal even if the procedure is successful. So, in conclusion, cesarean section, it is useful in beef cattle. It can be successful and it can be economically beneficial. And if you have any questions, unfortunately I will not be able to answer them, but I'm sure Dr. Cutler would be happy to field any of those for me. So with that, I hope you enjoy your Tuesday afternoon, and thank you for your time.